Congratulations, you have completed the hardest part of this course. This next module will be covering general laws pertaining to healthcare providers, the practice of dentistry, the practice of dental hygiene, certification of the dental assistant. As you probably know, there are lots of changes for the dental assistant. These changes take place several times each year as the board meets and enacts new rules. So please stay connected to the Texas State Board of Dental Examiners website for changes. This section of the Practice Act is written for any health care provider. The dental board has the obligation to suspend, revoke, or disqualify a person from practicing dentistry if the license or certificate holder has been convicted of a felony offense requiring imprisonment and or if terms of parole are not followed. A graduate can be disqualified from licensure if they have been convicted of a felony that directly relates to the duties of their occupation. The board will consider the nature and seriousness of the offense as well as consider the possible relationship of the crime to the profession, and finally decide if licensing would create an opportunity to partake in more illegal activities. The board must determine if the crime would damage the individual's ability to perform specific duties. An example of this might be the case of a teenager who made a poor choice and used a fake ID in obtaining alcohol. Altering a government-issued ID can result in a felony offense. The board would likely consider this type of a one-time offense and allow a licensure. However, if a person is convicted of drug abuse and is applying for a license as a dentist who would be allowed to write prescriptions for Schedule III drugs, that would likely not be a favorable outcome. If the board receives information that a licensed practitioner has defaulted or not repaid a student loan, they may have the authority to deny application for license or renewal of a license or certification, suspend a license or certificate, or revoke a license or certificate, or take disciplinary action. Additional duties of the State Board are required to provide examination procedures. For those who have been licensed in this state for some time, the Board no longer conducts many of these examinations, but is tasked with providing a mechanism for testing candidates. The Board must also establish procedures for renewal of licenses or certifications, which include schedule for license or certification renewal and a method for these payments. There is an exemption for renewal of licensure during military duty. The next few slides will focus on the practice of dentistry in Texas. All licensed dentists must have passed national and clinical exams, be licensed by the Texas State Board of Dental Examiners, adhere to codes Chapter 256 and rules of Chapter 101. Only licensed dentists can own dental practices. Anyone practicing dentistry in Texas must be licensed by the Texas State Board of Dental Examiners. In order to obtain this license, they must be a graduate from an approved school, be at least 21 years of age. The delegating dentist is responsible for the act that is delegated. This is a key phase to remember when delegating tasks to auxiliaries. Section 258.001 lists impermissible delegations or specific tasks that cannot be delegated to anyone other than dentist or dental hygienist. Those tasks that can be delegated only to a dentist include comprehensive examination or diagnosis and treatment planning, a surgical or cutting procedure on hard or soft tissue, the prescription of a drug, medication, or work authorization, the taking of an impression for a final restoration, appliance, or prosthesis, the making of an intraoral occlusal adjustment, direct pulp capping, pulpotomy, or any other endodontic procedure, the final placement and intraoral adjustment of a fixed or removable appliance, the placement of any final restoration. Now we will shift our focus to the practice of dental hygiene. Each dental hygienist in Texas must be licensed through the Texas State Board of Dental Examiners. To qualify for licensure, a person must have graduated from an accredited program, be 18 years of age, passed all examinations, both written and clinical, CPR certified, taken the Jurisprudence exam, and paid all fees. A hygienist works under general supervision, which means that the hygienist can see patients while the dentist is not in the office, providing the patient has been seen by the dentist in 12 months preceding the appointment, and providing the hygienist perform work within the confines of the Practice Acts. Typical dental hygiene duties include the following reversible tasks: removal of accumulated matter, tartar deposit, accretion stains from natural or restored teeth, smoothing root surfaces, polishing exposed tooth surfaces, making dental x-rays, applying medicaments topically to teeth. Additional dental hygiene duties include instruction in proper oral hygiene. Placement of Pitt and Fisher sealants is now included in the curriculum of all accredited dental hygiene programs. Therefore, a dental hygienist who graduated after 1980 does not need additional certification from the board. However, those graduated before this date will need additional board certification. The flowable composite material permitted as long as the dental hygienist does not cut the tooth surface. Provision for a hygienist to work in long care facilities or school-based clinics is continued in Rules 115.5. Within this rule, a hygienist with 2 years of experience can provide the initial treatment for a client. However, there must be written authorization from a dentist, and the client must then be referred to a dentist for examination. The hygienist cannot see the patient a second time without the dentist exam. There is a chance that school-based clinics will expand the duties of dental hygienists to include fluoride varnish within the Head Start programs. Watch for this area as the rules for new information. We will shift our focus to the dental assistant, where many changes have occurred recently, beginning with the aspects of vocation that have not changed. The dentist may not delegate to the dental assistant removal of calculus, deposits, or accretions from natural tooth or restorations, smoothing of tooth by polishing or root planing, comprehensive exam, placement of a final restoration, prescribing a drug, medication, or authorizing laboratory work, anything considered irreversible. There are many new regulations for dental assistants in Texas. The latest information is found on the board's website. This module will next discuss the current radiology certification and registration, as well as sealant certification process for dental assistants. Applications for registrations and renewal for certifications are submitted to the State Board of Dental Examiners. The applications are reviewed within 3 working days, and if complete, the registration will be mailed to the dental assistant. If not complete, the application will be returned with an explanation of additional documentation that is required. Registration is for 12 months for any dental professional. Prior to the expiration date, the dental assistant should receive a notice from the board. The dental assistant should then mail payment for the renewal of fees, submit proof of current CPR, provide proof of 6 hours of continuing education within the last 12 months. A registration expired for 1 year or more will not be renewed. The certified dental hygienist shall display his or her certificate of registration in the dental office where they are employed. The word shall was selected to mean that it is a requirement of the board for all to display their registration. If a dental hygienist works in more than one location, additional copies can be obtained from the Texas State Board of Dental Examiners. A photocopy of the registration is not permitted as this is a legal document. However, the board will allow a 30-day grace period to receive the current registration document. A licensed dentist may delegate the application of Pitt & Fisher sealants to a dental assistant if the dental assistant is certified by the board. There are many requirements for a dentist to maintain annual renewals of anesthesia permits. In this module, I will discuss only nitrous oxide and the role for the dental hygienist and dental assistant. The dentist is the only licensed person to administer this level of sedation. The dental hygienist and dental assistant can monitor the patient, providing the dentist maintain direct supervision. Once the exposure to the patient is complete, the auxiliary should document in the patient chart their participation in care. For the dental hygienist and dental assistant, there is no annual renewal for this permit. This is the end of Module 2. Please refer to your assignment page to conclude this Jurisprudence Module 2.